Welcome to this explainer. Today, we're going to act as your personal whiteboard doctor to unpack the real, hard science behind vitamin E. We're moving right past those flashy internet trends and looking strictly at pure, source-based facts. So, whether you're chasing that perfect skin glow or trying to protect your internal organs, stick around because we've got a lot of genuinely fascinating ground to cover.
Okay, let's dive right into this. You know exactly what I'm talking about. We've all seen those famous green capsules popping up all over our social media feeds. They're literally everywhere. But are they really the magical cure-all for your skin and hair that the internet claims they are? Or are we kind of misusing a really powerful medical tool? Let's find out. Today's consultation takes an outside-in journey. We're going to cover 1. The vitamin E hype, 2. The truth about skin and hair, 3. Internal health and healing, 4. Natural foods versus supplements, and 5. Crucial medical precautions.
Starting off with Section 1, the vitamin E hype. What exactly is vitamin E?
Well, what's really interesting here is that vitamin E isn't just one single thing. It's actually a whole family of 7 distinct chemical compounds known as alpha tocopherols. All those magical health benefits you're always hearing about, they're hidden right inside these specific compounds. It's a complex little family working together. And its main job in your body is absolutely crucial. It acts as a fat-soluble, heavyweight antioxidant shield that protects you from oxidative stress. Think of oxidative stress as biological rust inside your cells caused by free radicals. This rust is what drives aging and disease. So, vitamin E, it's basically your body's ultimate rust-proofing agent.
Moving on to Section 2, skin and hair, the truth, external versus internal use.
Now, this is where things get controversial. On one hand, internet trends and beauty channels strongly suggest cutting open these green capsules and mixing that thick gel with coconut oil, rose water, or aloe vera. They promise glowing skin, vanishing scars, and rapid hair growth. But on the flip side, medical dermatologists firmly warn against doing exactly this.
And the crucial point is right here. Raw capsules are designed to be digested, right? Not smeared on your face. They completely lack the specific chemical vehicles, things like solvents and emulsifiers, that are actually needed to penetrate your skin barrier. Dermatologists point out that by using raw, sticky capsule gel, you're really just risking redness, rashes, and severe irritation without giving your skin any actual vitamin E benefits.
Which brings us to Section 3, internal health and healing.
So vitamin E's true magic actually happens inside the body, not just on the surface. When you take it orally, as intended, it becomes a heavyweight champion for your internal organs. It actively fights heart disease by lowering your bad cholesterol and triglycerides, all while supporting healthy blood pressure. Amazingly, it even helps clear dangerous fat deposits from the liver in people dealing with non-alcoholic fatty liver disease. It also prevents the breakdown of red blood cells, which really aids folks with hemolytic anemia. But wait, it doesn't stop at the heart and liver. It acts as a literal shield for your lungs against modern city pollution and asthma triggers. Plus, it's highly recommended for reducing oxidative damage in heavy smokers. At the same time, it's protecting aging brains against cognitive decline and diseases like Alzheimer's. Oh, and remember that skin glow everyone is chasing online? Taken internally, vitamin E boosts your natural collagen production, giving your skin real elasticity from the inside out. Furthermore, studies show it significantly relieves painful menstrual cramps, what doctors call dysmenorrhea. It's a total powerhouse for reproductive health, helping regulate cycles and improving both male and female fertility parameters, like boosting sperm count. Plus, if you have internal tissue damage from burns or radiation therapy, it speeds up that internal cellular healing process. It's doing a lot of heavy lifting. Let's look at Section 4, natural foods versus supplements. How should we be getting it?
Listen, before you go turning to pills, just look at your pantry. You can get massive amounts of vitamin E naturally, safely, and without any side effects. Dry roasted sunflower seeds, almonds, avocados, kiwi, and green veggies like broccoli and spinach are absolutely packed with it. In fact, here's a really fun, surprising fact for you. Just 1 single tablespoon of wheat germ oil provides your entire daily recommended requirement of vitamin E. Literally just 1 spoonful, and you are completely covered for the day. Now, if you and your doctor decide a supplement is actually necessary to treat a deficiency, you'll generally stick to a 200 or 400 milligram dose. And here's a pro tip straight from the medical sources. Because vitamin E is a fat-soluble vitamin, you must take it right after a meal for your body to properly absorb it.
Finally, Section 5, Crucial medical precautions. Safety always comes first.
We have to remember this isn't just a harmless little beauty vitamin, it's a powerful active compound. That means you must avoid it or at least seek strict medical guidance if you have a history of heart disease, heart attacks, diabetes, or kidney issues. Crucially, if you have any surgery scheduled in the next 15 to 20 days, you absolutely must stop taking it immediately because of how it interacts with your blood.
And speaking of blood, this is a massive red flag. Because vitamin E affects the blood, mixing it with prescription anticoagulants, blood thinners, can be incredibly dangerous. You always need to disclose your supplement use to your doctor. No exceptions.
Another vital rule, because it's fat soluble, vitamin E doesn't just safely wash out in your urine the way vitamin C does. Instead, it accumulates. It builds up in your body's fat stores over time. This means you should generally never take the supplement for more than 3 months at a time to prevent a toxic buildup. If you do ignore those limits and take too much, trust me, your body will let you know. The signs of vitamin E toxicity include severe, persistent headaches, nausea, abdominal pain, and a deep, unexplained fatigue. It's your body's alarm system saying it's overloaded.
So as we wrap up this explainer, I want to leave you with this final thought to chew on. Instead of chasing flashy internet trends by rubbing raw capsules on your skin for superficial results, isn't it time we start genuinely nourishing our cellular health from the inside out? Armed with this knowledge, you can now make the smartest, scientifically backed choices for your body. Thanks for joining me on the whiteboard today, and keep learning.